Good day, my name is Sharonda Coleman, and I will be doing a presentation, a webinar called Opioid Addiction. The goals for this webinar today will be to understand what opiates are and how they are impacting the lives of millions of people today. We will also explore the environmental factors contributing to opioid misuse. We will recognize signs of opioid misuse and addiction. We will also um, learn skills that can help protect the safety of those struggling with an opiate addiction. Okay, the body's natural opiate system. The body naturally releases several different opiates during behaviors like exercising, eating, and socializing. When these opiates attach to the receptors, they can suppress pain, slow breathing, uh, reduce a sense of calm. As you can see in the picture, it shows endorphins and it's transmitting cells and the receiving cells, and also it shows a large endorphin molecule, which are to the left. And as you can see, there is a lot of endorphins being released in her brain activity, which stimulates that she could have been exercising or having sexual intercourse. Opiates. What are they? Opiates are drugs that are based on or derived from opium, a powerful substance naturally containing morphine. Opium is considered a highly addictive narcotic and is commonly abused by its users. These substances have medical uses and are one of the most commonly prescribed medications for for short-term and chronic pain. As you can see in the picture, this is an opium plant, a very beautiful plant. Just so you know, opiates make the body feel good. It is it stimulates the pleasure zone, and is usually used for treating pain, as stated previously, and they produce a much stronger effect than natural opiates, which you see in the picture, and they are very, very highly addictive. Okay, with opiates, we have two categories. We have non-synthetic opiates, and we also have synthetic opiates. The non-synthetic opiates are heroin, morphine, and codeine. And the synthetic opiates are oxycodone, another name for it is oxycontin, hydrocodone, another name for it is Vicodin, and we also have fentanyl. Some street names for heroin or dragon, dope, heroin, hero, hero, big H, big white, China white, white horse, white lady, boy, black tar, black pearl, black stuff, brown stuff, crystal, brown sugar, brown tape, Mexican horse, snowball, white boy, smack, skunk, number 3, number 4, number 8. Those are most of the common names for it. Some street names for morphine is Mr. Blue, Morpho, Dreamer, and God's Drug. Some street names for codeine would be Captain Cody, Schoolboy. Codeine syrup mixed with alcohol is considered as lean, drink, or scissor. Codeine mixed with sedative, they call doors and folds, loads, pancakes, and syrup. Okay, with the synthetic opiates, like I told you, they call them oxycontins. We call them oxys, hillbilly, heroin, kicker, OC, oxysets, perks, and roxys. For hydrocodone or Vicodin, street names for that is hydro, Norco, Vicky's, Vike, Watson's 387. Um, Street name for Finland is Apache, China Girl, China White, Dance Fever, Friend, Goodfella, Jackpot, Murder 8, Tango, Cash, and TNT. Finland, if you guys don't know, is a patch with effects similar to morphine, but it's 50 to 100 times more potent. And synthetic opiates are usually more concentrated than non-synthetic ones, which makes it much easier for people to overdose on them. Okay, next we have the most common opiates. The most common opiates are prescription pain relievers such as hydrocodone, oxycodone, Percocet, Vicodin, morphine, codeine, and Finland. The illicit opiates are heroin, and the maintenance medication is methadone. Hydrocodone and oxycodones are two medications that have really exploded in the market as common medications for treating pain. And we also have Percocets and Vicodin, which includes acetaminophen, which makes them even more stronger than the hydrocodone and oxycodone. And we have morphine, which is often used to treat acute pain in a hospital setting, but it's also can be prescribed for long-term use. A lot of cancer patients usually are prescribed morphine. And Percocets are usually for people with severe back injuries. They have like metal plates or screws or rods. Codeine is an opiate that is commonly worldwide and is still in a number of cold medicines because it carries 10% strength of morphine in it. Finland is a fully synthetic opiate that is extremely potent, and it has rapid onset and a short duration. And also Finland is usually associated with some type of illegal drug, like street drugs. Okay, the potency varies with Finland, and it's known that it's hard for you to know what you're getting because it can be snorted or injected like other prescription opiates. And also we have methadone, which is used to treat the addiction for opiates. Opiate addiction. Opiate use is a habit forming, especially when opiates are not taken as prescribed. Opiate addiction can be described using three basic components: overwhelming psychological desire to use opiates, increased tolerance to opiates, withdrawal symptoms when opiates are unavailable. Opiates also disrupt the natural reward system by flooding the brain with large amounts of dopamine, which I showed you earlier in the picture. Also, people addicted to opiates experience uncontrollable cravings for opiates that persist after they stop taking the drug. Opiates are intended to be used as pain managers and anesthetics, given their ability to block pain receptors in the brain. They drive up the dopamine levels in the brain and give the user an intense feel-good sensation. Opiates are more difficult to quit than some of the other addictive substances. The important thing to remember with opiate addiction is that it creates long-term changes to chemical balance in the brain, which can make it very difficult to recover from. If used over an extended amount of time, the brain becomes used to the intense feelings and require higher dosages of the drug to receive the same result. In other words, that what the user started with to get high, to get that feel-good sensation, they have to double or quadruple the amount of that same drug to get the same effect. Withdrawal. As the body gets used to a regular dose of opiates, it slows production of natural opiates. When the dose is not taken, the body experiences uncomfortable withdrawal symptoms. And the opiate withdrawal timeline states that first you 10 to 24 hours, you vomit, 36 to 48, you have sweat, nausea, running noses, dilated pupils, and watery eyes. 48 to 72 hours, you had started experiencing anxiety, insomnia, and localized pain. And all symptoms gradually start to fade away within 72 hours to 1 week. Health effects related to opiates. The health effects of opiates are partially determined by dosage and route of administration. The most critical health risk is the high probability of overdose. And as you can see in the chart here, it breaks down the psychiatric, neurological, behavior, respiratory, cardiovascular, gastric, hepatic, muscular, extremities, trauma, infections, and dermatologic. You can experience outside of the body symptoms of addictions. Opiates can have some of the negative effects on the body. They can cause some problems with digestion and constipation, being the most common. A lot of the other symptoms that you can see in the figure is that somebody using it, whether it's orally, nasally, or injecting. But the most concerning is the high risk of overdose. The brain builds up tolerance to the euphoric effects of opiates faster than the effects of the respiratory depression. So as people use more opiates, they can stop breathing if the doses are too high. Health risks associated with injection drug use is HIV, hepatitis C, inflamed or collapsed veins, skin infections and abscesses, and endocarditis. Hepatitis C is the virus of the liver, and 60% of the infections occur because of proper use of injecting the drugs, and it can cause bacterial directly to the body. And impurities in the drug can also damage the veins and blood vessels, which lead to the endocarditis, which the virus spreads to the bloodstream and damages areas of the heart. And this is a picture of heroin injected, broken down. Opiate epidemic. Drug overdose is now the leading cause of accidental death in the United States. Drug overdoses have doubled since 2002, and opiates are involved in more than 3 out of the 5 drug overdoses. Okay, this shows the prescription opiate sales and the deaths. But just to name a few facts, that from in 2010 were 4 times in 99, and the substance use disorder treatment admission rate in 2009 was 6 times more than in 99. In 2012, 259 million prescriptions were written for opiates, which is more than enough to give every American adult their own bottle of pills. 4 in 5 new heroin users started out misusing prescription painkillers, and 94% of recipients in 2004 survey of people in treatment for opiate addiction said that they chose to use heroin because the prescription opiates were far too expensive and harder to obtain. The increase in overdoses has been accompanied by a similar increase of sales of opiate painkillers, and you can see how it's continually to increase. 80% of heroin users start with prescription drugs, and however 75